right, we have had three very interesting presentations and a little bit of a common theme in terms of impact on lives, the use of data, very true to this morning's theme of data fostering health innovation. What I heard is that we've got an improvement or a leveling of impact on lives. What I would like the group to think about, and this kind of goes back to what our earlier speaker spoke to, is thinking about the whole notion of community-based participatory research. As a qualitative researcher, I know I'm a little bit of a nerd, but I love looking at qualitative data, and qualitative data is also data. You use it a little bit differently than you use the numbers, and in the research world, we call it using mixed methods. With the changing demographics and the new normal that we're experiencing in our society today, how might the CBPR, or the community-based participatory research process, this whole idea of learning from those with whom we're interacting, how might using that data inform us to create different types of intentional strategies to move our needle differently? So my point is that we're collecting a lot of data because we're doing a lot of stuff. So we're collecting a lot of numbers. And each of you all talked a little bit about, we're collecting these numbers. Ryan, you said, we got a lot of stuff, but we don't know why. You know, you've got a lot of numbers, but there's a lot of other stuff that's going on. People are thinking about you all. Your workers are talking to your clients. So there's still a lot of unanswered questions that could perhaps inform us in terms of the work that we're doing. Scott, you said the students are learning. They're learning. So there's some whys out there in addition to that, the carries that they had. So there's some qualitative efforts that could perhaps inform us in terms of those inventions. And I know that's a lot to think about in a short amount of time, but what might you develop in terms of community-based participatory kinds of things to help to inform the work that you're doing?
I love this question because we're doing some of it. So we're doing community-based participatory research in two neighborhoods, Walnut Hills and Mount Auburn, two neighborhoods that have really high infant mortality rates. We have learned some really interesting things. So one example, use of birth control. So white middle-class folks like myself tend to always go to pretty simplistic answers. So oh, we need more access to birth control. That's the problem, and that's sort of the conversation I'll have again and again and again. And I believe we do. I believe that is part of the problem. However, that's not what folks on the ground are telling us. What they're telling us is there are much larger issues around male desire to use birth control, even birth control they don't have to participate in. One of the largest reasons women tell us they did not use birth control is that they thought their partner was sterile. So there's a lot of men out there saying, oh, don't worry about it, baby, I can't get you pregnant. And that's something we need to know if this is a problem we're trying to solve. It's not just about making birth control more accessible. It's about changing the culture around the use of birth control in pregnancy in communities. And the other thing I'll say, Karen, is when I talk to traditional medicine folks, I always tell them about the importance of community. When I talk to folks who are really community-minded, I always try to remind them that guess who also doesn't have the complete answer is the community. So I think there's magic in sort of bringing together both sets of, whether it's thinking through public health professionals and the community, medical professionals in the community. To me, it's sort of where the Venn diagram can overlap and how much can we get it to overlap where the real magic is.
And that's the whole genius of mixed methodologies. The whole genius is finding that sweet spot and finding where the intersection is. That's the whole genius of doing that kind of work. Yep. Scott.
I think, the value of participatory research and at the community level, I look at it on down the road. I really appreciate qualitative research because
you're a social worker.
I'm a social worker, that's right. And I'm getting help, so I'll admit it. But we can talk about numbers and data all day long, But when I go before policymakers at the state legislature, they want to hear stories. They want to hear people. How has this changed lives? They want to hear the qualitative. They want to look at the numbers. But if we want to get the policy change that occurs, they want to see the child who now has that gleaming smile and talks about, you know, how their older brother or sibling had all these problems. They'd never been for a dental visit. Now they're no longer afraid of the dentist, and they'll go, and it's fun. And now mom and dad is actually seeing a dentist as well, because it's not someone to be feared. In the early childhood development realm, public health, we do a lot in hands. I had the opportunity to testify before the Legislative Oversight Committee that gives us our hands funding, and we had a lot of people there with lots of technical stuff that we'd tell them all day. The legislators were most interested in hearing from the mom who participated, who had her child in her lap, who was fidgeting all around and being a child, and the child talking about how much they enjoyed the hands visits. That's where it translates. So I'm really big on practice-based research, translational research. Plato said education is the kindling of a flame, not the filling of a vessel. So we want to have great bright flames kindled with all these researchers, but also fill my vessel. And when we got problems out here on the street, let's do research not just for research's sake, but that we can translate into making a difference in the lives of people day in, day out.
Yeah, and I think the answers there is that it's not either or, it's both and. And I think that we can all play in the sandbox together, and understanding that is where I think we're at when we talk about this data. We have this discussion all the time at the university level, well, I'm a quantitative researcher, and you just do qualitative, you don't count. But the fact of the matter is that we both inform, both qualitative and quantitative researchers come together, and at the intersection, I think, is where we can really do some great work. Yes?
So, if you could tell by the gray hair, I've been doing this a while, so I've been doing this like 40 years with the homeless. And over those years, I have seen the trends come and go, from guys on the street to bag ladies. We don't have them anymore, have you noticed? To families becoming homeless. This year's in vogue focus is youth homelessness, in case you haven't noticed. That's the topic du jour, and the specificity of that topic du jour is GLBTQ youth. Because that just is, that's where we are today. There is no good data on GLBTQ youth, really. As they're relating to homelessness. They are not in our database as big and of an issue as anybody will tell you they are in this community. But it is still an issue, and it's an issue we want to know about, right? So our hope is to be able to use the new way for clients to go into Vesta and actually record their information, to begin to collect the information on those youth, to find out what's really going on with them and what their sexuality, how that plays into their homeless journey. And we think that using technology with kids that are used to it, that probably are going to answer a survey on a site-based Vesta faster than they're going to answer a survey from you sitting there and asking them. And more honestly, is the way that we're going to get that qualitative data.
Yes. Let's open up the questions to the floor. Yes, right here. They want you to use the mic, please. There's one in each aisle. Thank you. Is it on? I think so. I think touch it.
No, still there.
There it is.
So I have a question for the panel. I know what kind of data I want, but I'm at the bottom level. I'm in the trenches, and I want to get some information so that it's useful for me. What approach did you start with, and what would you recommend to get that ball rolling? Because I look at it as, I know what I want to know, but I've got to rely on much bigger entities to give it to me. So what kind of approach, like when you started Cradle Cincinnati, I mean, where were you going for consensus and cooperation?
Sure, great question. So a lot of our data is not data that we generate ourselves, and it comes from partners, including one of the most important sources of data for us is vital statistics data, and we've got partners in the room who help us get that data. But part of that, I go and talk with other in other communities, and they say, you know, how do you get this real-time access from the state of Ohio? And it goes back to what Scott was saying around, this is something that you have to sell to policymakers. You know, we are all, whether we like it or not, in sales. And tying the data to larger stories, tying the data to, you know, hey, Ohio 2 years ago had the worst infant mortality rate for African Americans in the whole country. It was literally the worst place to be born if you were a black baby. And that's a compelling story that people want to figure out how to participate in, how to solve. People, especially policymakers and CEOs and folks, they can get pretty bored when you start talking data, but if you can convince them that you need access to that resource in order to solve the larger problem which they care deeply about and which they feel is going to make a big difference for their constituents, for their employees, whoever it is that you're speaking with, we try to make that case. We have cases built for different types of people. So we have economic cases for people who don't give a crap that babies are dying, but really care that this costs millions and millions of dollars for our community. We have those built. We have cases for folks who honestly just want to hear the story. Great, we'll tell you a story if that's what you want. And so trying to think about sort of different audiences, who is it you're talking to, and how do you build that case for them?
I would also suggest partnerships with your local university, your local colleges. They are a great untapped resource. You always have students that are looking for practicum placements, looking for projects, master's level graduate students. They can be such a value to what you're doing. You know, and just through these partnerships with the University of Kentucky, with the University of Louisville, Morehead, Eastern, Western, you can often get data on programs, you can do some research, and just, you know, it's good to link academia with the practice world because they start thinking differently through a partnership there at the University of Kentucky. Now, my health department, every semester in the spring, we're hosting the rural public health class. You know, the instructor was teaching her students about what it was to do health in a community and work at the local level, and she'd never worked at the local level, or none of her students had ever been there. So what a novel idea to make a field trip one day to a health department. You know, they didn't realize that I had bats in my refrigerator, you know. You know, so environmental is an interesting field. You know, so you don't know what it is there and the benefits of those partnerships, and to really be able to maximize the use of that. But don't overlook students who are looking for research projects, especially your graduate level students.
All right, well, thank you all so much. I've been told that we have 1 minute left, so I want to thank the panel. Can we give them a hand? And I want to thank the group for again asking me to moderate, and also just a reminder how important this whole notion of utilizing data to foster the improvement of our health in our region. I look forward to continuing to work with everyone and helping that to happen. Thank you and have a great day.